With measles, well, there are lots and lots of studies out there that show if you got measles as a kid, you have a heightened immunity against certain kinds of cancers, against atopic disease, against cardiac disease and allergic disease when you get older. So having those childhood diseases, which were essentially rashes in many cases, and were self-limiting and harmless to almost all children, it immunizes you and it builds your immune response in the future against all kinds of really bad disease that actually kill you.
Measles is a highly contagious childhood virus. It can present itself as flat red spots that first appear in the face and continue to travel down the body. Measles show itself 7 to 14 days after infection. The first symptoms are high fever, cough, runny nose, and red, watery eyes. 2 to 3 days after the first symptoms, tiny white spots or Koplik spots appear inside the mouth. 3 to 5 days later, the rash begins to appear. Fever spike up to 40 degrees Celsius. Small bumps appear on top of the flat red spots, and the rash may connect as it spreads. Contrary to claims, measles has no long-term benefits for your health, but instead has long-term complications. Study done by Gadroen and colleagues shows that up to 5 years of observing after an infection with measles, it still has an impact on the host resistance to non-measles diseases. Another research finds that after measles infection, people are more liable to be infected by opportunistic infections. Using population-level data, we show that measles has a more prolonged effect on host resistance, extending over 2 to 3 years. The research also concluded that there are fluctuations caused by measles every year or 2 in non-measles death. In conclusion, there have been studies done that shows measles having a long-term complications for those infected with it. People infected with measles are shown to be more likely to be infected by other diseases.